maybe 30 seconds and see if anybody comes in. In your package that were sent by Rose on January 30th, you'll see a binder title with the agenda and public comment. And I guess good afternoon, Ali. Good to see you. Ali, are you okay if I take roll call?
Yeah, you might want to wait about 30 more seconds. Looks like we got a couple late arrivers.
Perfect. We'll wait 30 seconds.
Okay.
Okay, it's 1:02. I guess we can start with roll call. And I see Bill.
Here.
Thank you. Dr. Laura Andrea Lara, you're here?
Here, yeah.
Good to hear from you. Michelle? Sally?
Yes.
Rick?
Here.
Thank you. Bonnie? All right. Rick?
Yes, this is Rick.
Oh, thank you, Rick. Tony?
Tony's going to be a few minutes late, Enrique.
Okay, thank you. Susan?
Present.
Thank you. Misty? Robert? Robert? Okay, so I have Misty, Michelle, and Robert, and Tony running a little late.
Like Bonnie may have just shown
Yep,
up,
I'm on.
Enrique.
I'm on.
Hi, Bonnie. Great to hear
Hey.
from you.
I had
Yeah.
trouble proving I wasn't a robot.
All right. Thank you, Bonnie.
I think you're good to go, Enrique.
And we have quorum. All right. So you have received the minutes of our previous meeting. So I need a motion for a member to approve the minutes of the January 6th. If there are any corrections, please let us know.
This is Bonnie, and I move that we accept the minutes of the January 6, 2026 meeting.
Thank you, Bonnie. Do we have a second?
Bill, second.
Thank you, Bill. Bonnie, you like to speak to your motion?
No, I went through it and they looked pretty much what I remember, but
All right. Thank you. Would anybody like to speak to the minutes? All right. Otherwise, I'll call the question. We're approving the minutes for our previous meeting that we had. All those in favor, I guess, put your little thumbs up on the computer or raise your hand so I can see it. If you cannot, put your camera on, you say aye. 1, 2, 3,
Aye.
5, 6. All right, thank you. Motion carries. We have adopted the minutes of our previous meeting. Okay, and we see the agenda that Rose has put in front of us earlier, and also you received it via email. I'll need a motion to adopt the agenda with flexibility.
Bill, I'll move.
Thank you, Bill.
Michelle has arrived, just so you know.
Awesome. Thank you, Michelle. Appreciate it. Good to see you. Bonnie, you second? All right. All those in favor to adopt the agenda with flexibility, raise your yellow hand or your thumbs up. Or say aye if you can't. Raise your hand.
Aye.
All right. All right. Thank you. All right. Motion carries. We have adopted the agenda with flexibility for today's meeting. Well, welcome everybody to our second meeting of the year. And we'll go right straight ahead to the agenda. And we have welcome customer satisfaction survey results. So we will have Aaron and Teslin from Mercer and Sarah from OHA to speak about the attachment on the agenda that we have in a board packet. So please, if you're here, unmute and start with your presentation since we have it on the screen.
Great, thank you. Hi, I am Sarah Berthium. I am, sorry, there's a bit of noise. I don't know if that's me.
If anybody has their unmute button, please mute.
Okay. Hey, hi again. I'll try this again. My name is Sarah Berthium. I am the communication lead for OEB and PEB, and we are here today to present the 2025 Customer Service Survey Review. And before we get into the results, I want to briefly ground us in why we do this survey. And so each year, the Customer Service Survey is one of the primary ways that we hear directly from members about how it actually feels to interact with OEB staff. That's when they need help, when they are trying to understand their benefits, or when they're navigating enrollment. And the survey gives us consistent, structured way to measure whether our systems, communications, and staff support are working as intended. And just as importantly, the survey helps us track trends over time. And so by asking many of the same questions each year, we can see where we're improving, where things are holding steady, and where members might be signaling a need for change. I'm happy to say that over the past few years, we have continued to see very high satisfaction rates across the board for our customer service, and we are happy to see that our members are satisfied with the services that they receive when they contact OEB staff. And the feedback we receive does not just sit on a shelf. We directly use it to inform decisions about customer service staffing, communication strategies, website improvements, and how we design tools and resources for members. So we look at this as a very important tool for us. With that context, I will turn it over to Aaron and Teslin to walk you through the 2025 survey results and key insights that they provide.
Thanks, Sarah. Hi, everyone. I'm Erin Ward from Mercer, and I'm going to kick us off with an executive summary of the survey, and then I will turn it over to my colleague Teslin to go into some of the detailed questions. And if you wouldn't mind going back one slide, please, that would be great. So wanted to let you know that the customer service survey for OEB was administered from October 20th to November 7th, 2025. And you can see that we had 4,342 participants in the survey. We also included this survey participation rates from 2021 through 2024. And you might think, oh, wow, there was a big drop in survey participants. I can say, so yes, there was a big drop. I will say for 2024 that survey was customer service survey questions combined with questions about the vendor partners, specifically the medical, dental, and vision plans. We also included the full suite of RealD and SOGI questions in that survey. And so normally when we advertise, it will take you about 5 minutes of your time to take the survey. In 2024, it was advertised as it will take about 15 minutes of your time, which is a big increase in people's time. And so we definitely saw a big drop from 2024. For 2025, we saw more, but it was still not up to the levels that you saw from 2021 to 2023. And we think honestly that there's just survey fatigue happening right now with members. That we've had several surveys. We also had the well-being survey, and this is a trend that we're generally seeing. We're also seeing it on the PEB side, so it's not just with OEB membership. So just wanted to explain that a little bit if you're wondering why that number is lower than what you've seen in the past. If we go to the next slide, as Sarah mentioned, that the membership who have responded to the survey are generally very satisfied with the customer service that they receive from OEB staff. The majority of members, 85%, were satisfied with overall services. That's 88% finding staff helpful, 86% finding the services were provided in a timely manner and that they believe staff to be knowledgeable, and then 79% finding that staff provided correct information. We did also include a write-in comment at that time to ask people if there was anything that any area that they wanted to call out where staff could improve, and the majority of respondents did not provide any kind of write-in response there. So we weren't able to really glean any insights into where there might be specific issues that we needed to work on. Going to the middle column, the satisfaction with communications, this continues to be really high from respondents, with 93% being satisfied with the methods of communication and 90% being satisfied with the frequency and the content and the effectiveness of it. We did also include that 77% of respondents prefer email communications, and Teslin will go through a detailed slide later on that shows the different preferences that people had, but email has consistently shown up as that top preference. And then last but not least, we do ask about the website, and there is high satisfaction with the website. Now this is oebinfo.com, so where you would go to get information about the plans that are available to members. So 89% are satisfied with content, 82% are satisfied with the site organization. We do also ask about oebenroll.com, so the site where people go to make open enrollment decisions, and 88% of respondents were satisfied with that enrollment site. Now on the next slide, we compared, for this year, for 2025, we did include some RealD and SOGI questions to help us understand who's impacted by health inequities. We did not include the full set in 2025. We included select questions where we could then use that data to compare against data that we have about the general OEB population. So we did not include that full 26, 27 questions. And just to give you a preview of how the respondents compared to the general population, a higher proportion of females participated in the survey than males, and this generally aligns with with OEB's general population. Members ages 18 to 44 participated in the survey at a lower rate than those age 45 and over. And again, this aligns with OEB's general population. And then respondents live primarily in Marion, Multnomah, and Washington counties, and this also aligns with OEB's general population. So I don't think I see any questions right now, but we'll monitor the chat. But I'll turn it over to my colleague Teslin, who will walk us through some specific questions and the results.
Great, thank you, Erin. Rose, if we could flip to the next slide. I'll go through about 10 of these detailed questions. And so before I begin, I just wanted to orient everyone to how these next few slides will look. We have the actual survey question that we asked running along the top of the slide. Then we have the main graph with the results, as well as some key takeaways on the right. You'll also see the exact number of responses that we received for that particular question. So you'll see those go up and down throughout, depending on if there was skip logic programmed into the survey, for example, meaning that for this question, for example, if someone answered no, they wouldn't answer the preceding question. But with that, so the first question that we ask is if a member contacted OEB staff between October 1st and September 30th, so last year's plan year, you'll see that a large percentage, like the majority of the people who actually took the survey, didn't actually have an interaction with OEB staff. So the next few questions only cover the 26% of the population that said that they did contact OEB staff in the plan year. These results are what we typically see over year over year, so this isn't at all shocking. We still get a large participation number, but just noting that the next few questions have a lower response rate because it's only asking the people who responded yes to this question. Rose, if we can flip to the next slide. So then we asked how people contacted OEB staff if they did in fact have a customer service interaction. You'll see here, I think to no surprise, that phone call is by far the most popular and common way for members to contact OEB staff, closely followed by email. Very rare to contact through the mail or in person, but we typically see members wanting to pick up the phone and ask questions to OEB staff when they have an issue or something that comes up that they want to address with staff. These are what the results that we typically see and align very closely to 2023 and 24 results. Then if you go to the next slide, we also asked members if they did contact OEB staff, what they were asking about. So you'll see here they were able to check all that apply, knowing that they may contact OEB staff more than once in a year, and they might be asking about different topics when they do so. So just noting that the percentages here don't actually add up to 100% because people were able to select more than one option. You'll see that medical benefits questions and information is definitely the top asked question for members, closely followed by open enrollment. I think that's no surprise that that's often what members want to get on the phone and talk to OEB staff about, especially regarding open enrollment. That's often when you might have questions about the different plan choices, etc. So medical and open enrollment are typically what we see. Last year, we actually broke out this question a little bit further. We used to just ask if they contacted OEB staff about benefits questions, but in the past 2 years, we've been asking, is it about medical, is it about dental, or is it about vision? And so you'll see that with that granularity in the data, we're able to see now that it's mostly medical benefits questions that people are asking questions about, or at least for the responses to the survey. Then if we go to the next slide, this is for people who did contact OEB. We asked them how they would rate their customer service interactions with OEB staff in a few key areas. So you'll see those areas running along the bottom of the graph. We ask about the timeliness of services that staff provide, the ability for people to provide services correctly the first time, just overall the helpfulness of how they sound on the phone or via email, the knowledge and expertise of staff, and then the availability of information, and then lastly, overall service. And so as Sarah pointed out, these are really great numbers that we're seeing, pretty much 80% above, 80% and above for every category of customer service. Members are particularly satisfied with like the helpfulness of staff, I think no surprise there, as well as the knowledge and expertise and the timeliness of services that are provided. These are very similar results to what we've seen for the past few years. So the customer service interactions continue to be very strong. And I just want to emphasize here that these are great numbers considering the fact that people often contact customer service when they might have issues or questions. And so just the fact that they're getting their answers quickly and accurately speaks to the amazing job that OEB staff are doing so far. Just want to highlight here that the green bars, in case this isn't clear, is a blend of both satisfied and very satisfied customers, with the blue bars or the lower percentage bars being unsatisfactory or very unsatisfactory. And then we can go to the next slide. As a part of this survey, as Sarah mentioned, we also ask about their satisfaction with communications. And so you'll see we asked how satisfied they were with OEB's communications in the past year in terms of the methods that are used. So this is it through email, or is it a mailer sent to homes, or webinars, or online PDFs, as well as the frequency. So how many emails are you getting? How many mailers are you getting? the content, so what's actually included in that and what the topics are covering, as well as the effectiveness. So can you understand the messages in the communications? And again, you'll see here really high satisfaction rates, 90% and above for all of these categories. That's really exciting to see, given OEB's heavy emphasis on communications and making sure that communications to members are really targeting people with the right frequency, with the right methods, and also at a reading level that is accessible to all and really easy to understand. So it's great to see that members are feeling positively towards communications, given the emphasis on, for example, the monthly newsletters and the importance around open enrollment. And then if we click to the next slide, we dig a little bit further into communications. Erin mentioned this earlier, that we asked people how they actually prefer to receive information from OEB. This was another question where they were able to check all the five. And you'll see that emails, for example, is the most preferred method of communication, with the website being a close second, or not so close second, about a 30% below. But I think this is no surprise, given that people are used to receiving communications via the email or going to a website to access information. Then you'll see that the enrollment guide, the online plan comparison tool, and explore your benefits are the next most popular. This is great to see.
Can you give me a second?
Yeah, of course.
Sorry, I hear some background and I'm trying to mute whoever is on mute. So if you could please mute yourself or double check your mute button. We hear people talking in the background. Thank you. So you can proceed. Appreciate that.
Thank you. Yeah, appreciate that. So I just want to call attention to the online plan comparison tool and the Explore Your Benefits, which have a 36% above them in terms of preference. It's great to see that these continue to be tools that members like to interact with, given that these are still a little bit on the newer side in the past 3 years. And these are a great interactive way for members to gain more information about their benefits through a digital online platform. So we continue to see those being a preference for members, and we're excited to see that those channels continue to be used. If we go to the next slide, we also asked members which version of the monthly newsletter they prefer. So I'll take you back in time to 2024. OEB's newsletters were the monthly newsletters that go out were focused on in-depth articles that covered a specific topic. And so there was a lot of background reading these articles in 2024. In 2025, based on feedback that we received from members, the 2025 newsletter transitioned a little bit more to include different methods of learning. And so it includes things like a 1-minute video or a podcast or links to more health condition specific references or resources. So that shift in 2025, we wanted to poll members about to see if they preferred one or the other. And you'll see that over 78% of members prefer that more interactive, different modality type of learning in the 2025 newsletter. And then if you go to the next slide, we just wanted to highlight what the 2025 newsletters actually looked like in case you haven't had a chance to view them. They have different links for, again, videos, podcasts, different resources, etc. So a very interactive format with different ways for people to learn. And I want to call out that these are from 2025. In the 2026 newsletter, OEB's continuing to listen to ongoing feedback of members and, for example, has shortened the podcast to be even more digestible and really focus on key insights and topics, continues with a short article that has really like digestible nuggets of information for members, and then also continues with a video. And these are all focused around specific health conditions. And so you'll see the January edition that came out, so definitely take a look at that on the website if you want to see more. And then also the February one will be out shortly. So we just want to emphasize here that we continue to get feedback and want to continue to update OEB's communications to make sure that we're aligning to members' preferences. I will pause there in case Erin or Sarah have anything to add here just on the ongoing changes. No worries. If not, I'll keep going.
I think you covered it.
Awesome. Sounds good. Then if you take us to the next slide, I will transition gears to the enrollment system. We ask how satisfied people are with the My Benefit enrollment system at oebenroll.com. So again, the way that members are actually enrolling in their benefits during open enrollment. You'll see here the green bar is 88% showing very satisfied or satisfied with that system. This is very standard in what we have seen year over year. So it's great to see that people are generally happy with that system and how they enroll. And then if you take us to the next slide, we finally asked about, in terms of communications, if there's any topics that people are interested in hearing more about, as OEB is always interested, as I mentioned, in getting member feedback and altering newsletter editions to make sure that we're hitting what members want to learn more about. You'll see here that wellness programs is one of the things that members are most interested in. So this would be, for example, learning more about the employee assistance program, gym discounts, weight management, and diabetes prevention. And then it's closely followed by also members being interested in learning more about their core benefits, so medical, dental, and vision. As I just talked about, the 2026 newsletters focus exactly on a combination of both of these two topics. So OEB continues to listen and update as needed. This is very similar to what we typically see, that people are very interested in learning about not only their core benefits and making sure that they're making the best use of those, but also wellness programs like fitness discounts and weight management, etc. With that, that actually concludes all of our detailed slides. So we can go to the next slide and I'll just open the floor for any clarifying questions that people might have. We're happy to answer anything.
Thank you. Any members have questions? I don't see our board members having any questions, but if we do, we're happy to follow up in writing with Ali and staff. Thank you for the presentation today.
Thank you all.
Enrique.
Thank you.
All right, members. So we're in the next third phase of our agenda, and there's a long-term care and UNUM decision. Barry from OHA and John from Mercer, please go ahead, and we'll have a motion, an item on this part of the agenda.
Thank you, Enrique. Hello, everybody. I'm Barry Burke. I'm the Deputy Director for OEB and PEB. And I wanted to offer a staff recommendation for long-term care and then give some background on why that recommendation, why we are recommending that. You can go to the next slide. So in October, OEB and PEB found out that we're notified that UNUM is no longer accepting new enrollments into long-term care. That's not just for OEB and PEB, it was across their book of business. They just aren't accepting any more new enrollments. So whether you're an existing employee who's not enrolled or you're a new employee, effective this past Sunday, you are no longer eligible to enroll in UNUM. Current UNUM employees who are enrolled that can change their plan, they can enhance it, they can reduce it, but just no new enrollments effective February 1st. Current enrollment in OEB UNUM is 1,300 for the employee long-term care and 209 for the spouse partner long-term care. And I want to follow up on a question that Enrique had last week about how many entities have enrollees in these plans. And we had, of the over 250 entities that are in OEB, 95 of them have at least one enrollment in a UNUM plan, and 169 offer the UNUM plan. And then just one other interesting bit about that is, of the 1,300 there, over 200 of those are with Portland Community College. And then the rest are around 1% to 2% or less of their total employee population. And next slide. So staff is recommending that we discontinue the long-term care benefit beginning with the plan year 26-27, October 1st. Since we got notice in October that Unum was discontinuing enrollments. We have met with the insurance division and with DOJ to make sure that member protections are in place. They will be rated as they always have been through their group plan. The OEB board doesn't determine the rate. The insurance division approves the rates, and so that will continue going forward. So part of the decision of discontinuing the administration of the long-term care plan is OEB would transition members to direct bill. So members can continue their long-term care plan, but they would be working directly with Unum. And we can go to the next slide. So there is some required communication if we do go to direct bill. OEB will need to give members and Unum 120 days notice before the effective date that we are going to transition to direct bill and no longer offer long-term care through OEB. So we would need to give that communication in May. And then in July, we would follow up with that communication with the form by Unum. Unum's going to pre-fill by group number and some of the pertinent information that they'll need. They'll pre-fill that form and OEB will send that form directly to the members, and the members will need to submit that form to Unum. Next slide. So what does the member need to do? Somewhere between August 1st and November 29th, they will need to submit the form to Unum. OEB will send reminder notifications during this transition period to make sure that members are reminded in order to keep their long-term care plan, they need to submit the form to Unum. And then direct bill would begin with October 26 premiums, and members would be responsible for any retroactive premiums back to October. So if a member submits a form on November 15th, Unum gets it loaded, they would need to pay October, November, December bill if they turn the form in after October in that scenario. And next slide. So the pros of transitioning to direct bill is really just an administrative advantage for both entities and for OEB and PEB staff. There would be no more deductions going through payroll. There would be no financial reconciliations with the entities about their Unum plans. OEB staff would not have to reconcile with Unum. We would discontinue eligibility files that are sending over terminations. Obviously no new enrollments, so it'd be basically just terminations that we'd be sending over. And we wouldn't have, we'd make a system change to just remove the long-term care page. If we continue to administer long-term care, then the system would need to identify those who are still in long-term care, show them what their current enrollment is, so that they can be assured they're still enrolled. But the members who are not enrolled in Unum would not see that page because they don't have an option to enroll. So I went through that pretty quick. Part of the staff recommendation is to end our relationship with Unum and transition members to direct bill with Unum, effective with the October 1st plan year.
All right, thank you. Are there any questions? Bill, go ahead.
A kind of a basic question. So through all of this, what have we learned by this happening?
By Unum giving us notice?
Or just how do we get into the situation and how are we going to get it how are we going to prevent it?
I can start on that one, Barry.
Yeah, I could
Yeah.
offer a few thoughts if it'd be helpful, Barry, for Bill.
Yeah.
I think this is not a Unum issue or a OEB issue. It's really an industry issue. When these group long-term care policies came out, they were underpriced. And they've never really caught up, frankly. And you saw a pretty serious increase last year, for the policies that you have that are inflation protected. So I mean, I think that, that's really how we got here, is that the industry did not price the product appropriately and, no longer is in a position to offer, group long-term care.
So as an industry, then, are we just not going to? Are we going to phase out long-term care then, because it's too expensive?
There really is no industry left, right, John? I mean, Unum was one of the last few carriers that actually offered group plan, long-term care plans. It sounds like nowadays it's more offered as a rider on a life insurance.
More of a hybrid, yep, exactly.
Yeah.
Okay. Other people are speaking.
Go ahead, Rick. I see you have a question.
I'm wondering if there are member employers who are providing the premium payments to their employees on a pre-tax basis. And have we communicated with them, or do we know how that's going to work for those member employers and their employees?
Yeah, thanks, Rick. I can't answer whether they are offering it on a pre-tax basis. I know that for all of PEB, it's post-tax, but I don't know for OEB for each entity. I do know that there is one school district that pays the premium for their employees for a certain classification of employees. And we have reached out to Unum for an exception for this plan year and were denied. But we can follow up with entities, the 95 that have at least one enrollment, and do a poll to find out who's offering, if anybody is offering it pre-tax.
And regardless, I guess, of the pre-tax status, that maybe just make sure those entities are aware and that they've worked out with their employees. Who's going to pay that premium? Are the districts going to pay it, or is the employee going to have to pay it out of their personal account? Thank you.
Michelle?
Yeah, so one of my questions was just around if there's another vendor, but it sounds like there isn't, so that's helpful. I guess I wonder if in sort of supporting members who want to continue to be covered through direct bill, do we have a sense of whether the company is going to continue to be able to provide those benefits? Like, it sounds like the industry is not doing well and maybe the company's not doing well. So I don't want to send members to pay premiums to like a company that's a sinking ship. So that's my question.
Yeah, they're required by law to continue those policies in force until, the duration of the policies. It's the one benefit that's regulated by the Department of Consumer and Business Services Insurance Division. And I think we mentioned a couple of months ago that there's going to be another 50% increase coming. And that's something they applied to do through the insurance division that really the boards have no control over. But you're right, Michelle. I think there's the ability for members to still go out maybe on their own, and secure a cancer policy, and other policies. This would simply be that. It would be them purchasing on their own. We would simply just be the middle person, kind of beyond the middle person, actually, for the future. Just protect, collecting a monthly payment and then passing it through. So we wouldn't really provide a whole lot of value from here on out.
All right. Are there any further questions?
If the board decides to go out for a life insurance disability RFP in the future, then the board could certainly look at potentially adding a long-term care rider or some other kinds of riders onto that at that time. But there's really just no large group policies out there to replace this one.
Okay. Are there any other questions? All right, so on this part of the agenda, we need an action item, and the motion needs to indicate that OEB to discontinue doing the billing after the plan year concludes. That would mean that members will continue their policy through UNUM directly, through pay directly to the insurance company like any other bill. And as one of the slides before, the deadline, it's right here, October 1st of 2026. So essentially, I need a motion for us to be able to move forward and indicate that we will discontinue this benefit. And I see a question up. Is that Michelle?
No, that's from before. Sorry.
Okay. No, thank you. Are there any other questions before we go to the motion? Essentially, what I'm hearing is that we need to transition out from this benefit because the company can no longer partner with us. However, if our reminder members want to keep this benefit, they will have to pay their bill directly through UNUM on their website, and no other member will be able to join this service. And if the members decide to continue under this benefit, they will cover the cost increase and any other necessary policy changes they'll be responsible for. And the reason why we are required to allow them to have this sort of benefit is because of policy, right? Meaning that we need to offer them, but the members need to still pay for this independently. So is there a motion on the floor for OEB to discontinue doing the direct billing after the plan year concludes? Do I hear anybody putting a motion forward?
That's Bill. I'll make that motion.
Thank you, Bill. Do we have a second?
This is Bonnie, I'll second.
Thank you, Bonnie. Bill, would you like to speak to your motion?
I just the motion as we will stop OEB will stop paying directly to UNUM for member coverages and stop offering it in the future for other members.
All right. Thank you. All right. So all those same without objection, do we like to adopt this motion as presented? All right. I hear no objection. We have adopted that OEB will discontinue doing billing after the plan year concludes. That means that our members who decide to keep this policy will pay directly to UNUM like any other bill. Motion carries.
And we'll follow up on Rick's question. Yeah. Thank you.
And also what I hear from staff is that there will be a number of reminders to those members about this change, and they will be directly responsible for this payment.
Yeah, and Ricky, just one follow up to that. We do have a question out to UNUM to see if they will provide us a report for everybody who has submitted the form to them so that we can continue to reach out to those members who haven't submitted the form.
Absolutely.
Thank you, Barry.
Thank you. All right, so we are ahead of schedule. So we have a break at 2:05 to 2:15, but it appears to be that the next presentation, number 4, is about the same time that we will be heading out to break. So without objection, we can just go to Willamette, VSP, and BHS canopy renewals with Kristen. All right, take it away.
Well, it's actually John. So I will cover it. I will cover these today.
Thank you, John.
Good afternoon, board members, and thank you for taking the time to meet with us today. And we have, what we're trying to do is cover some of the renewals today so we can have additional time next month to discuss medical. And if we could, we need to get to the top of the presentation. There we go. Oh, one down. There we go. One more, please. There we go. Thanks. So this is really an orientation slide. So before we dive into the content for today, we just want to ground ourselves in what the board is trying to accomplish. And really what the board is trying to accomplish is to improve the health of the members, both the educators and the assistants. And here we kind of see, the mission and the vision and the goals, and the specific goals that were set out in the retreat in November are here, which is, providing that high quality, affordable care, growing the OEB membership, reducing out-of-pocket expenses for members, exploring an RFP, and then providing member education. So those are the goals. Again, just trying to give us some thought to these as we dive into the material, for the renewals. And then feel free to just ask any questions as we go along. Okay, let's move on to the next slide, which is really, this is what we call the arc of the renewals, and we're really at the height of it. So in February, we move into this evaluation and negotiation phase, which really will go on and through April. And so the next several months are really key to the renewal process and the board's involvement in that process. So each month we will have a round of renewal with the various carriers, and we'll evaluate their responses. And these rounds also provide an opportunity for the board to jump in, and dig a little deeper if there are things that they're hearing that and today's presentation is an example of that. If there are things that you're hearing today that you want us to follow up on in the next round, this provides you with that opportunity to do so. And again, working to wrap up the board decisions, by the end of April. And again, the goal here is to allow time for the open enrollment communications and also time to make the necessary administrative changes, in the enrollment system and things like that for 10-1. Okay, let's move on to the next slide, which is really, again, this really just serves as a reminder of the current, programs and partners that you have in place. So as you can see here, Kaiser and Moda, provide medical, dental, and vision. And then there also is an additional dental option in Willamette and an additional vision option in VSP. And then life and disability is provided by the standard. And again, there are many different flavors of life. There's the basic life that is employer provided. There's additional life and spouse life and child life, which are employee paid. And then you have disability, and there are a variety of plans for short-term disability and long-term disability. Some of those are employer paid, some of those are employee paid, depending on the entities. So there's a variety of things with that. And then we also have the supplemental programs. We have weight management with Weight Watchers, and then we have Benefit Help Solutions, or BHS, as we typically refer to them. And that's really the COBRA administrator. Then we have Unum that we just discussed. And then we have Canopy, which is really the EAP provider. So that's the constellation of programs that you have in place today. It just gives you the full lay of the land before we dive into what we'll be focusing on today. Okay, moving on to the next slide. And let me just kind of walk you through this. I know there's a lot of information here, but what we're trying to do today is really focus on Willamette, VSP, BHS, and Canopy. And then as I alluded to earlier, that's so we can really focus on medical next month. Unum, we've already discussed. So I think, we won't be talking about Unum in this section, even though it's listed here for completeness. And in the March meeting, just a few more details about the March meeting, we'll be covering Kaiser and Moda renewals for all their lines, the medical, the dental, and the vision. And they will also be covering the standard and Weight Watchers at that point as well. The other thing to note here is there are rate and fees and fee guarantees in place for many of your programs and partners, VSP, Unum, Weight Watchers, BHS, and Canopy. And essentially what this means is that there are fees that are already in place. So there's really there's no real need to negotiate renewals for this year, at least in this renewal cycle, that there are multi-year rates or fees in place. And for the most part, when you have those guarantees, multi-year guarantees in place, it will not, typically there's not going to be a need for the board to make a decision. For the ones where the board will need to make a decision, if we're looking at this last column, that's again, for the most part, there will be board involvement in decision making, except for Unum, BHS, and Canopy, because again, the board just made the decision around Unum and BHS and Canopy are in rate guarantees and they're really not looking at any options around with those. Just as a quick reminder, our approach to these various rounds of renewals is really we go out with the renewal letter, we get round one back, we go through round one, we scrutinize what comes in and then push back on behalf of the OEB board and in an attempt to kind of negotiate lower rates and fees based on our analysis. And then we go through this in several rounds. So there's several back and forth. And then at the end, we have this balancing, which is really where the board needs to make the decision about, balancing the impacts of potential benefits and of the various options. So essentially, we'll be bringing, the board options, and the board needs to, weigh those options and balance the impact, the goal of reaching that 3.4% with any benefit changes that might be required to do so. So that comes later in the process. Next slide, please. And the next one. So for the next couple of slides, we're going to go take a deeper dive into the renewals that we have back already, and then kind of let you know where we are. And then, we will, pause to if there are any questions and if there are any follow-ups that the board would like us to take to the various partners. So for round one, Willamette renewal is coming in at 9.9% increase. Again, this is, as you know, a bit of a challenge because of the 3.4% cap. To our understanding, this increase is related to additional utilization of preventive services, basic services, and particularly orthodontics, and also as well as higher operating costs. So these factors have kind of come together to generate this level of renewal. And I think it is worth pointing out that this is a bit of an anomaly for Willamette, because historically they've been able to pull in renewals that are under 3.4%. So we have met with Willamette and are working with them on other options that don't solely rely on plan design changes to achieve the desired increase. And we'll provide you with an update next month, that addresses the mix of plan design changes and other options that are needed to bring the renewal in at a 3.4%. And these options will be brought to the board, and the board, for the board's consideration and making a decision. Okay, I'll move to the next slide. And the next slide just talks about the benefit changes that Willamette is proposing. And essentially they're proposing to discontinue the new patient office visit copay waiver This is something they've been trying to pursue for several years. And I think it's because in their estimation, this waiver is no longer necessary, in terms of enticing people into the dentist. And this doesn't have a premium impact because it was something that was funded by Willamette Dental. And other than this, they're not indicating that there'll be any benefit changes, mandated benefit changes for the coming plan year. Let me pause there and see if there are any questions from board members or things that the board would like us to pursue with Willamette through the renewal process.
If we have any questions, when do you think you want those questions back by, or by?
As soon as possible, really, and then because that then we can kind of get them into the next round, which is happening very quickly. But again, if it doesn't get into this round, we have other opportunities to kind of continue to pursue it. So if there's anything, go ahead, Ali.
Yeah, I just wanted to, just as a reminder, that, the 3.4% statutes measured on a composite rate of the average medical dental vision plan for an employee. So, yeah, when we see an increase of this size for dental, it definitely does impact the overall delta between getting to that 3.4%. So just a reminder. Thanks.
Thanks, Ali. And then we'll move on to VSP. On the next slide. And here we're in the second year of a multi-year rate hold from VSP, so we're in good shape. As long as there are no plan changes, that it will be a level increase for the next renewal. And the rate hold is in place through 2028, the end of September. Okay, we'll move on to the next slide. A couple of things around VSP just to highlight, interesting observations from what came in. So VSP continues to build its network both through acquisitions. In the example here is the iMart Express. And they have locations in Bend, Bedford, and Eugene and Roseburg, and then also through contracting, with additional community providers. And you can kind of see, how many additional doctors they've added over the last 2 years. So, which is good in terms of access. Then there's also one benefit option that was requested of them, and so this was around high index lenses, and currently there's no benefit for high index lenses, and it is the highest used lens option out there. And just to go into what that is, high index lenses essentially allow people with stronger prescriptions to have thinner lenses. So this is something I very much appreciate, because if I didn't have high index lenses, I'd have much, much thicker lenses on my glasses. So again, this is highly utilized. So we had them price it out. And it's, while there's savings to members, adding the coverage, for the Choice Plus plan for high index lenses would result in a combined increase of 7.6%, which is, again, probably not where the board wants to go this year. But again, we wanted to give the board the opportunity to decide whether to move forward with this, at the given time. So we're not asking for that decision for today, but it's really just something to be thinking about and can be considered down the line. Okay. Oh, Rick?
So I guess the question would be, if the copay was not $15, but maybe $30 or $40, would that significantly reduce the percentage increase in the premium.
Yes. Yeah, that would. And that's something. So if that's something that you'd like us to go back and ask, we can definitely do that.
Not knowing how expensive high index lenses, how much that adds to the cost of a set of eyewear, maybe people would be happy to pay an extra 30 or 40 rather than the full upscale cost.
Yeah, we'll go back to VSP and ask them, Rick. That's a good question. Thank you. Thanks for your question. Any other questions? All right, for Benefit Health Solutions or BHS, again, this is COBRA administration. I'm sure you're familiar, COBRA is the program that allows people who are no longer in your employ to continue their benefits, typically either for 18 months or 36 months based on, the reason for the separation. So BHS is they're in a fee agreement through the end of 2028. And you'll notice, yes, the increase is over 3.4%, but I think what's important to realize that we're talking about, essentially 3 cents a year that it's going up. So I think, and this is after several years of no or limited increases. It's a matter of them trying to catch up a little bit here, and that's what you see going on with this renewal. So, assuming there are not a lot of questions on that one, we'll move to EAP, which kind of closes out this segment. And here there's also an agreement in place. So we're in the last year of a 3-year agreement that brought in Canopy. A couple years ago, you can see what the administrative fee is, and we thought it might be a good idea just to remind people what the EAP benefit includes, and it includes services both for members. So there's 24/7 hotline. There's counseling visits. There's behavioral coaching, and there are 8 visits for each of those. There's unlimited virtual peer support. And then there's a whole range of these resources for life. Legal is typically the ones that is most used, but there's also financial, people who are having financial difficulties that they provide guidance there, and, getting referrals for those who have those needs as well. And then there are digital tools. The example given here is the digital cognitive therapy. And that kind of that rounds out, the member directed services. Then you also have the organizational support services, which I think most importantly are around those unlimited management consultations, unlimited critical incident, support, and then, and also some training and things such as that. So again, just a quick reminder of, the range of services that are offered through Canopy as your EAP. So with that closes out the, so again, Enrique, we might be running a little ahead of the schedule, but that's what we have to cover this month, and definitely appreciate the additional question from Rick, and we're open to other, additional questions that you would like us to address through the renewal process.
Yes, thank you. If you have any questions, please feel free to Ali, so he can forward them to staff as soon as possible. I know sometimes listening and reading the materials, we might come up with some questions, and having the review is helpful with to help with staff. So it is 2:04, and the next item on our agenda, it is a legislative update, and I would like to just go to the legislative update and then just go to a 10-minute break. So Glenn, if you're available.
Sure. Rose, can I share a slide?
Should be able to now, Glenn.
Okay. Okay. Sorry about that. Yeah, I just wanted to give folks a kind of overview on what's going on with the legislature right now. As many of you know, the legislature started meeting on February 1st for its 2026 session. This is one of the short sessions, so it's only going to last through March 8th, unlike their long sessions, which go into June. Some of the key dates, really, just to keep in mind, is February 16th, they have to vote a bill out of the first chamber. And this applies to their what's called the policy committees. You can keep a bill beyond that date if it's in, say, Ways and Means or Finance and Revenue, and there are some other select committees. February 22nd is the date when they need to get it out of the second chamber, and their work sessions have to be scheduled by February 20th. So right now, a lot of work's being done. They're already scheduling public hearings for this week for their bills. In regards to legislature or legislation individually, we have 63 bills that Health Policy and Analytics is watching. There are about 49 bills which PEB and OEB are monitoring. And we actually break these bills down by priorities. Priority 1 would be a bill that would put a whole new program on PEB and OEB. Priority 2 is usually a benefit bill or another one that's going to just change our, say, our premium rates. A priority 3 means it may impact us, but we can do it without any added cost or any, policy impact. And then 4 means we're just watching it. Say we're watching it to make sure it doesn't get amended, so it does impact PEB and OEB. So in comparison to really last year, we're doing, there are not that many bills that really are affecting us right now. We have one of the priority 2s and then 7 priority 3. The 2 bills I did want to, go over to ones that are kind of bills of note in a sense that we're either watching or we are, actively putting in a bill analysis or fiscal impact statement forward is House Bill 4040. This is an omnibus bill. This is, I can't even remember how many pages it is, but it's like one bill with 6 or 7 bills inside of it. We have gone over this bill. At this moment, it's a priority 3 for us. None of the changes that are happening in there are going to have a big impact on us or fiscal impact. The hearings is on the 5th, and there are other amendments expected on this bill. So we are, as I said, actively watching and monitoring this bill. The one priority 2 bill is actually a copy of a bill from last year. It's in regards to infertility benefits. It's requiring that all health plans, including PEB and OEB, cover pretty much all the range of infertility benefits. Most specifically for PEB and OEB is it requires that we cover IVF, which at this time we don't cover within our plans. The other issue about this bill is that PEB and OEB, or I'm sorry, OEB, and 2 of the PEB plans use benefit maximums, which is a kind of a ceiling on the total cost that you can spend on infertility benefits. That really helps keep the cost down, because especially when you get into IVF, they're very expensive procedures. This bill would not allow that. The identical bill from last year, Senate Bill 535, would have led to an increase of 1.7% on our health premium rates, due to having to add IVF and then removing some of these really cost containment capabilities used by health plans. This has a public hearing on the 10th. And we're submitting a benefit analysis and are expecting a fiscal impact statement on this. These are really the 2 bills of note. I mean, I'm happy to, if folks have heard of others you think affect PEB and OEB, or just in general you had questions, I am, really happy to either look into it or answer it if I know it right here.
I open the floor for any questions. I see there's no questions, but I do have a question myself, or maybe
Sure.
we can work through Ali. As you said, it's a short session, and a lot of us have daily lives and we're not professional government relations like yourself. So I was wondering if you, through Ali, can work in just a quick summary of what's been moving at the legislator that impact OEP or PEP that will impact us ultimately, if that could be possible.
Well, sure. I can do these reports. I can give you a more specific from what I provided about what would impact. Would you want to know, like, are you seeking like kind of an analysis of all the bills that we're currently watching, or just the P's and P2s and P3s, so to speak?
Yeah, I just said P2s and P3s, but for example, we know not all the bills are going to have a hearing, or there's, by the next time we meet. So if there's 3 bills or 2 bills in 2 or 3 weeks from now, and there's movement, I would like for us to get an update
Okay.
for this. That's all. Go ahead,
Yeah,
Ali.
I certainly can. What I can do is after the 9th, we'll really know, because that's when they have to schedule the work sessions, what bills are moving and what are just not even going to get a hearing. And I can certainly type up a report next week and send it out, or the
That'll be
week
helpful.
after.
Yeah. Thank you. Go ahead, Ali.
Yeah, that's a great idea. And I just wanted to mention that we stay in close contact with our OEB Advisory Committee, who obviously include a lot of legislative coordinators. So if you have any questions or comments, I mean, I think we can definitely provide like a weekly status report of bills that are moving, like Enrique suggested. And I think, again, the OEB Advisory Committee's really kind of helped us all get on the same page as far as knowing what legislation is out there and what needs to be done. So yeah, thanks, Glenn.
All right, thank you. So we have no more questions for Glenn. It's 2:13. Let's take a 10-minute break, and let's be back. Go ahead, Ali.
Yeah, just it. That's great. Thanks.
All right, so let's be back at 2:22. Is that correct? Yeah. All right, so we'll be back at 2:22. Thank you.
Thank you.
All right, everybody, welcome back. I know that we are moving forward on the agenda. Let them think we all take that anytime. So we can go back to our busy schedules, most likely emails and other meetings at this time of the day. And I'm looking for board members, and I think almost everybody's back. Awesome. And I see Glenn is here. And he's the next one on the docket. But also, I would like to invite any board member who was at the Seattle meeting this morning, if they would like to add any updates that Glenn might add, or you can add to his report. So, Glenn, welcome back and take it away.
Well, good afternoon to everyone. The See Out today, we worked on two items. The first one was Mercer has been conducting, I would say, for the past almost 6 months, a review of our cardiometabolic vendors. This includes any of our vendors from Omada to Weight Watchers to Predi to the carriers themselves that provides a support for diabetes prevention, type 2 diabetes management, as well as weight management overall. And then also the purpose of this would be to really then come up with some recommendations for the 2026 renewal cycle. This was a very detailed report that was presented. It looked at a number of different areas. The general themes that came out of this is that member engagement across all the vendor programs is low. And then some vendors had better clinical outcomes than others. There were also, they provided for each program a recommendation about maintain, areas of improvement, or, ideas of, that we should consider for possibly changing or replacing these programs. It was decided, though, that the best thing would be, since it was a lot of information that was put forth, that we'd see how members would review it. Then in March, would come back and we'd make specific recommendations for these different programs for the 26-27 renewal or onward if applicable, that would then be forwarded to the OEB and PEB boards. The second item on that is coming out of the November retreat. The OEB board had chosen cardiovascular conditions, especially, efforts to prevent and monitor cardiovascular conditions at the carrier level. This was adopted as part of the 26-27 renewal. What Mercer did is asked a number of questions of our carriers related to, what programs are in place, what has been the utilization, what are the outcomes. But for this presentation, what they did is they presented, what is the optimum really care paradigm that you want to use when you're, really treating or preventing cardiovascular situations and emergencies. So they really went over a very detailed paradigm. It was really looking at three pillars: proactive interventions, removing barriers for members and providers, and then improvements to the member care experience. the next step that they'd like to now take that, because they got information from the carriers kind of on what the programs were and some on enrollment, but they want to take this paradigm, working with, take it back with the carriers, do a gap summary with the carriers, and then come back for the March meeting with specific, or later in the renewal, with specific really recommendations on how we can, or the carriers can improve their programs based on this optimum care. So they will be coming back to CIAO for specific recommendations, and then we will be moving those recommendations to the boards. Really only these two items, but they're, very big, and especially the vendor management, looking at type 2 diabetes. There was a lot of data, really good, report that went over many of the different areas. So, I would, well, as Enrique said, if others want to kind of jump in, who were in attendance at the CIAO meeting, and other really impressions you got, or things that should be pointed out.
Dr. Lara. Go ahead.
I think, thank you. I think it's just like, for me, I mentioned this, and I'm happy that we have a little more time to process the data. It was really, we noticed a lot of limitation with Robert and Bill. So I'm glad that we have a little more time to process that information. Thank you.
Go ahead, Bill. You have a question?
No, I was just going to say thanks for covering that, Glenn.
Thank you. And thank you, Glenn, Dr. Lara. I guess my takeaway on the agendas that I have seen and listened to Glenn is that we might need to dedicate some time to understand the data, as it might be limited, or for some of us who are not data scientists, might need some time to, catch up and analyze that, and then go back with their questions to make the proper recommendations to the board. But I appreciate the work that the group does, and it's a deep conversations to happen in those meetings, and we just get the high level summaries, which are important. So I encourage all the board members to attend. They're all invited. So we'll make some time in the next agenda to go over the data, or with leadership to understand better. Thank you.
Yeah, and we'll make sure when the recommendations come that we, also include some time to go over that data, so that, folks can better understand.
Thank you, Glenn. Okay, so we have Innovation Work Group update. Margaret Smith from OHA. You're next.
Yeah, hello there. Good afternoon. It's good to see everyone. I will share another largely sort of informative update on the most recent work of the Innovation Work Group. Certainly invite questions and share a little bit about kind of where the work group's focus is heading. So to kick things off, the work group last met last week, Wednesday, January 28th. On the agenda for the meeting, each one of the 3 OEB and PEB contracted health plans had some time on the agenda to provide presentations to share their insights on recent cost trends for the plans. In particular, part of their presentations was in response to level of payment data that the work group had reviewed at their December meeting, late 2025. That data compared OEB and PEB payments across categories of healthcare services in comparison to Medicare payment levels for those services. And the data showed, that in recent times, OEB and PEB payments have generally been increasing faster than Medicare payment levels. So in those carrier presentations, they shared sort of their perspective, different information from each health plan. kind of some of the information noted that with respect to cost increases, pretty much universally carriers cited that health system labor costs, general inflation, and also to some degree increasing utilization among the population in the recent past couple of years has contributed to the cost growth trend. Of note, they noted that roughly 50 to 60% of hospital operating costs are due to labor and benefits, and that in recent years, workforce challenges, travel nurses, labor shortages, all of those things have hospitals report have really contributed to their increased operating costs. Carriers also noted that Medicare's rate of increase varies based on provider type to some degree, and that some providers would note that in the recent past, the rate of increase that Medicare is giving has not kept pace with their cost increases, and that some provider types are having little rate increases or even small decreases in the amounts that Medicare is paying them in the most recent couple of years. So that sort of factors into the data when we think about how commercial rates look and the trends on commercial rates compared to Medicare as our benchmark. So all part of the discussion. The work group also looked at data on comparing 2024 to 2023 hospital utilization and costs. That data report looked at top diagnoses and costs for both hospitals that are capped under Senate Bill 1067 and uncapped hospitals. Work group members have really expressed a very keen interest in developing sort of more tactical options and approaches, some of these perhaps very focused as strategies to manage cost pressures. And these would be things like reference pricing, perhaps for certain types of services, or steerage to efficient providers and sites of care programs that could encourage or incentivize members to use lower cost settings. So sort of informed by all of this data, staff in the coming weeks is really going to be working behind the scenes to try to identify within the data where there might be categories of services or opportunities or types of providers where there might be some potential to explore these types of tactics. That'll be in part the agenda for the next work group meeting, which is scheduled for Monday, March 16th. The hope is that the work group is really going to spend some time sort of getting a little deeper into what does the data tell us in terms of where to focus and what are our options for focus. And to ideally, ultimately identify some specific options that could be shared with the boards for potential action. So the work continues in progress, certainly moving along, and welcome, any and all board members who, care to or are able to join into those meetings. And I'm happy to take any further questions at this point.
Any further questions for Margaret? All right, again, if you have any further questions, feel free to email Ali, and I'm sure Margaret will be happy to get back to all of us.
Yep,
all right.
Absolutely. Thank you.
Thank you, Margaret. Appreciate it. And I want to acknowledge, I just saw Robert Young. I know he's been here for a hot minute, so welcome, Robert. Sorry I didn't see you earlier. The other part of our agenda, which is almost the last part, it is public comment. You received a letter from a member regarding the GLP-1 and weight management. So we have received feedback from the member, and we'll work with Ali in addressing any further questions on that. I know that members often contact Ali and us, and if we receive comments or feedback from members, we can always address them to Ali and staff to help us answer those questions. I know I have a question for Ali and staff about one of our members, getting denied insurance coverage. So I'll be following up with Ali. So that's the reason why we're here. We represent our members. We get to hear their voice, and we also get to work with staff to solve those complex problems. Ali, do you like to add anything for the good of the order?
No, that's what we're here for. And, this coming month, we're going to be starting our renewals for the next plan year, and it's going to be very challenging, as we've been talking about. We're going to get data information into board members' hands as soon as possible. So you'll have a chance to familiarize yourself with the materials before the board meeting, and it'll be a pretty jam-packed next couple months. But it's again, that's why we're here. So we as staff, our Mercer team, our OEBB advisory committee, I think we're all, going to be working together to get there. And so be on the lookout for that, and we'll keep everybody updated.
Thank you, Ali. For any comments from the board members for the good of the order?
I have a quick little comment for the good of the order.
Go ahead. Yes, Sally.
I'm the classified benefits coordinator at 4J School District in Eugene, and we had our first employee benefits fair on the last Friday, since before COVID. So the first one I participated in, and I just want to thank Canopy couldn't come in person, but I thank them, for sending materials, and Moda and Kaiser and Willamette Dental all came, and I just appreciate what our vendors do for us, and that they showed up for our members, and our members had a really, really great time. We had over 30 vendors, but specifically want to thank our partners here at OEBB for coming.
Thank you, Sally. Appreciate that. Well, members, we will stay in touch. I know it's a short session. I'm sure Ali and Glenn and others on staff will communicate with us if anything comes up that we need to be aware of. Thank you, Rose, for helping us with the PowerPoints and keep it on track and send those agendas. Board members, good to see you all, and look forward to seeing you in the next meeting. Or if you have any questions, please email Ali, and I'm always available. Feel free to email me, and we'll stay tuned.
Thank you so much.
Thank you, everybody. Bye-bye.
Thank you.